Hello, my name's Justin Gill, and I'm so pleased to be here with you today and excited that we can join virtually for our Introduction to Legislative Advocacy event. These past few years have posed many challenges for nurses across our healthcare system, from staffing and workplace safety to school nursing challenges and payment parity for nurse practitioners. Make no qualms about it. We continue to face a staffing crisis, and each and every one of you out there, we need you. Nurses across the state are struggling to be able to provide the quality care that they want and should be able to provide for their patients. The leaders and administrators that are placing this burden on nurses and healthcare need to hear and listen to us. As nurses, we care so deeply about providing safe, quality care to our patients. We're implementing our staffing bill that was passed in 2023, thanks to the relentless advocacy efforts from nurses that helped it pass. This legislation holds hospitals accountable to their staff and patient safety. It also closes loopholes on other issues impacting nurses today, such as meal and rest breaks, staffing committees, and much more. This growing movement of nurses, healthcare workers, and patients are making their voices heard in Olympia, right now on this very issue through political advocacy, media, and community engagement. If we want to make real positive change for our profession, we must exercise our voices, and that's exactly what we want to teach you how to do effectively here today. As nurses and humanitarians, you have a duty to care for the sick, but you also have a right to express some need for reciprocity and fairness in the way that you're treated. In today's program, we'll have some materials to help you develop and refine your advocacy skills. Much of this will focus on reminding you of the skills that you already possess as an advocate for your patients. Let this be the start of your advocacy journey and not the end. Enjoy.
Hi, my name is Tarra Simmons, and I am a proud representative of the people of the 23rd Legislative District here in Kitsap County. My district includes Bainbridge Island, Paulsbo, parts of Bremerton, and parts of unincorporated Kitsap County. I am a lawyer today, but I also was proud to be a registered nurse for 11 years, working in the profession. I worked in a variety of different forms of nursing, from long-term care, emergency room nursing, med-surg, and ended my career as a disease management nurse for an insurance company. And then I went on to law school, and now I work on the intersection of behavioral health and the criminal legal system pretty often, but I always go back to my roots of being a nurse and knowing how hard nurses work and the difficulties that you face in advocating for your patients. Today, I think I am the only former nurse or nurse of any kind in the legislature, which is really difficult because we are making a lot of policy and we don't have very many healthcare practitioners that make up our body. And so it's very important that nurses understand that your advocacy for your patients does not stop at the bedside. There are so many things that are wrong with our healthcare system here in Washington State and in the nation. And there's so many needs that your patients have. And you are the subject matter experts. We need you to tell us what we need to do to fix the problems that you're facing and will face in the future, whether that's has to do with your working conditions or you see a consistent systemic barrier in getting access to care for your patients, and other things that your patients need to be healthy. It's really important that you show up and that you talk with your elected officials and identify those issues and let them know what it is we need to do. And then when policy is going through the legislature, I am proud to serve on the Healthcare Committee and the Appropriations Committee, where a lot of healthcare policy comes through both of those committees. And I really rely on frontline workers to tell us, if that policy is meeting its intended goal, or is there something we can do to make it even better, to make sure that we are actually addressing the needs that you've identified and that you are dealing with every single day. So please don't hesitate to reach out to me, Representative Tarra Simmons, or other members of the Healthcare Committee, or your own elected officials in the districts where you live. and build those relationships. And so that way you can stay informed and you can be the best advocates for your patients, not only on an individual level while you're caring for them in a variety of settings, but also on a more systemic level. Thank you so much for your interest in this work. Thank you for all that you do and you will do to help keep our citizens in Washington State healthy and safe and thriving. We can't do this work without you. Thank you.
Hi, everyone. Today I will be giving you more information on our state legislature and why it is important for nurses to participate in the legislative process. By the end of my presentation, I hope you will have a better understanding of WSNA's government affairs work and our legislative goals for this year's legislative session. As a nurse or nursing student, it is important to realize how much power the state legislature has over your practice and your working conditions. Some of the reasons it is important to be engaged in advocacy in the legislative process are because the legislature has the power to assure your scope of practice, assure safety on the job, assure quality patient care, assure access to education, and assure that nursing has a voice when health policy is made. Nurses have participated in the state legislative process for years. And when nurses work together, they have the power to make a real impact. Just a few examples of past successes from our collective efforts include securing full prescriptive authority for advanced practice nurses, a state mandate that all nurses be given proper meal and rest breaks, and a requirement for hospitals to limit mandatory overtime. And most recently, in 2023, the legislature passed two significant laws impacting nurses. The first was a requirement for labor and industries to properly compensate and provide access to health care for nurses who suffer PTSD on the job. Also in 2023, the legislature passed an update to the state staffing law, which, among other things, created staffing protections for nurses working in hospitals and penalties for hospitals who don't comply with the hospital staffing plan, which is created by a team made up equally of management and frontline workers. It's also helpful to know that Washington State has 49 state legislative districts. Just like congressional districts, the districts are based on population, which is why you see much geographically larger districts in the rural parts of our state and tiny districts in the Puget Sound area. Each district has a senator and 2 representatives. And since most people don't remember high school civics, I want to quickly review the 3 branches of state government, which of course mirror the federal level. First, there is the executive branch, which includes the governor and lieutenant governor and the state agencies, such as the Department of Health or Labor and Industries. The legislative branch includes the state Senate with 49 members and the state House of Representatives with 98 members. And then there's the judicial branch with the state Supreme Court. WSNA advocates at all 3 branches of government. We work closely with the governor's office and state agencies. We lobby the legislature, and we file lawsuits for things like meal and rest break violations that have worked their way through our state's court system. And before we spend time learning about how to successfully advocate, I want to be sure everyone understands the context we will be advocating in this session. Our state legislature operates in a 2-year cycle called a biennium. The first year is a long 105-day session. Long sessions always happen in odd-numbered years. Since we're in an even-number year, 2024, this session is a short 60-day session. After session, the entire House of Representatives and part of Senate will be up for re-election this November. During the first year of the biennium, the legislature passes the state budget. This year, they will pass what is called the supplemental budgets that make changes based on how much revenue the state is bringing in and caseloads for things like public schools and Medicaid. Bills that were not passed in the first year of the biennium carry over with the same bill numbers. New bills will have new bill numbers. And in our state, Democrats continue to hold the majority in both chambers. And of course, our governor is also a Democrat. Now let's talk about the state Senate. Currently, the Democrats hold the majority of the 49 seats in the Senate. That means that the Senate Majority Leader is a Democrat. Pictured here, you will see Andy Billig from Spokane. He is the current Senate Majority Leader. This year, we have a number of changes with the state Senate, as several senators have thrown their hats into different statewide races for the 2024 election. One notable candidate to step down is Senator Rolfes. In her place, Representative Drew Hansen was appointed to her Senate seat, and Senator June Robinson was promoted from Vice Chair of the Ways and Means Committee to Chair. The Democrats also hold the majority in the House. Democrats represent 58 of the 98 House seats. Here you will see a number of newer representatives who were elected in 2022. Representative Lori Jenkins is the Speaker of the House. The legislature takes on many topics a year, but often they have a focus per biennium. This biennium's focus is on housing, behavioral health, climate change, and racial equity and justice. Now we are going to dive into WSNA's 2024 legislative priorities. SB 5373 requires insurance companies to prioritize patient access to care by paying advanced registered practice nurses the same rate as physicians for the same services. ARNP reimbursement parity, in other words. Payment parity is crucial for increasing patient access to care. Currently, labor and industries as well as Medicaid already pay ARNPs at the same rate as physicians. This bill is asking the state to require private insurers to do the same. Legislation and funding are needed to create statewide standing orders allowing school nurses to purchase and administer epinephrine. This is exactly what House Bill 1608 does. This will ensure that students receive immediate care in the school building without relying on outside healthcare providers to shoulder this responsibility. It also ensures that the legislature's authorization for schools to stock these emergency medications can be put into practice. Hospital acquisitions and mergers are becoming more and more common every day. In Washington state, there is very little oversight of these transactions by government. SB 5241 requires the Attorney General to review all major transactions impacting patient health and access to services. Depending on the transaction, the public will also have an opportunity to weigh in. In 2001, Washington voters passed an initiative that created a 1% property tax cap. Prior to 2001, local governments could increase their property tax revenue collections up to 6% per year. Under this property tax cap, local governments are limited in their ability to raise revenue to support local services. This includes public health. As the years have passed, revenue has not kept pace with inflation or population growth. WSNA is asking legislators to support a property tax cap increase. This is particularly important in King County, where just recently, County Executive Dow Constantine is quoted as saying that without new sources of revenue, King County may have to close all 10 of their public health clinics. It is important for nurses to participate in the legislative process and to be advocates for yourselves and for your patients, because we can pass new laws or update old laws that aren't working as well as they should. But the other reason to reach out to your legislators is that just speaking up and helping elected officials understand what it is really like to be a nurse, whether in acute care or public health nursing or school nursing or long-term care nursing, can influence change. This photo is of ICU nurse Paul Fuller from Wenatchee. Paul shared what it was like working as a nurse during COVID with the Senate Health and Long-Term Care Committee. And this was the result of Paul sharing his experience as a nurse. This is a Facebook post from former Senator David Frocht, who was the vice chair of the Senate Healthcare Committee at the time. And this is what he posted on his personal and state Senate social media after hearing Paul testify. In the last decade, I've participated in hundreds of hearings. Occasionally, you hear testimony that is so compelling and relevant that you want to share it with as many people as you can. Thursday morning was one of those instances. If you have 5 minutes, watch and listen to Paul Fuller's testimony. Just sharing our stories with legislators is extremely impactful. To be a successful advocate as a nurse, you don't need to know the policy details. You don't need to understand every aspect of the legislative process. You just need to tell your story. What is it like for you? What is it like for your patients? What do you need to make your job better? And now WSNA President Justin Gill will tell you exactly how you can advocate on behalf of yourself and your patients.
Hello, everyone. My name is Justin Gill, and I'm the president of the Washington State Nurses Association. I'm excited that all of you are joining me today to discuss an introduction to legislative advocacy. Really, the goal of this presentation is to provide you with some skills and some thoughts to consider as you move through your journey of becoming an effective advocate. For many of you, you have had the chance to meet with your lawmaker or policymaker in the past. So hopefully this will serve as either a review, reminder, or supplement to some of the skills that you already possess as you've met with your lawmakers in the past. So what is the purpose of lobbying or advocacy? Well, really it is to promote the legislative priorities of a specific coalition, group, or individual. So in this case, it could be the State Nursing Association, it could be you as an individual nurse, as a healthcare provider, or regarding an issue, say you're working in coalition with at a local or state level. Really, the point is to assume that the lawmaker is not persuaded or fully aware of the issue. Your role is to develop the most effective way to persuade that policymaker. Lobbying plays a major role in policy development as well. Contrary to public opinion, I know that the word lobbyist oftentimes gets a negative connotation, but it really is that primary way that lawmakers learn about a particular problem. And you don't have to be a lobbyist in order to advocate as a professional nurse. Because remember, you are the expert. If we're not speaking on behalf of our profession and priorities, other groups will be happy to speak for us on our issues. So it's important that we're present, active, and focused when we meet with our lawmakers so that we can promote our priorities for our profession and our patients in an effective way. So I do have a fun video that we'll watch at the beginning of this presentation. And my suggestion would probably be to take some notes about things you notice about Sally Sue in this video, who's a nurse that is very concerned about a lot of problems going on in her hospital, as well as some ideas for potentially improving her experience that you noticed during her presentation.
This is Sally Sue. She's been a nurse for 3 years. After getting her feet wet and learning skills necessary to carry out nursing care with ease, she began to notice certain problems in her healthcare setting. She began to really think about these problems quite frequently. It concerned her even when she wasn't at work. It bothered her so much that she felt she needed to do something about it. Finally, it dawned on Sally. She'd go to meet with her senator. One day, after getting off the night shift, Sally was so upset about this continued institutional problem that she decided to drive straight to her senator's office. Sally went right into the office and asked to meet with her senator.
Hi, I'd like to meet with Senator Jones to discuss nursing and patient safety.
What's your name, ma'am?
I'm Sally Sue from Central Hospital.
Do you have an appointment with him?
Well, no.
Okay, let me check with him to see whether he can fit you in, okay?
The staffer seemed a bit taken aback.
I'll see you at the committee meeting then, okay? All right. Okay. Yeah, that works. Okay. Bye. Yeah, she can probably walk with me to the next committee meeting. That should work. Yeah.
Okay,
Okay.
I will let her know.
Okay.
And I've talked to all my girlfriends at other
Yeah.
hospitals, and they say the same thing. Like, it's getting really, really bad.
Yeah. Okay. Well, is there a bill number for this, or is there any kind of?
I don't know if there is, but if there
Okay.
isn't, there should be.
Okay. All right.
The staffing is really bad.
Okay.
The patient safety, like,
Uh-huh.
there are just so many problems.
I see. Okay.
We really need you to help Senator Jones. And
Well,
I could go on and on.
And I hear you.
Let me just say.
Yeah, this is my floor. I actually have to go to my committee meeting.
Okay.
Feel free to leave your information with Winnie, and we'll try and get back to you as soon as we can.
Okay.
All right.
Well, thank you,
Okay.
and I will
Thank you.
definitely
Take
talk.
care.
Thank
All right,
you.
bye.
Oh, poor Sally. Her heart was in the right place. She cares about her patient's safety and about the profession of nursing. But that went wrong. Really wrong. What do you think Sally could do to have a better next meeting with her senator next time?
So back to some resources here. The Washington State Legislature has some helpful tools to help you find your lawmakers and their information or committees. Do an internet search for the lawmaker to access their campaign webpage. This might have more helpful information on their background. Also, consider following them on what was formerly known as Twitter or X, Facebook, Instagram, or other public arenas. This can provide you with helpful information about who the lawmaker is, what issues they focus on, what their background is, so that way when you have that conversation with them or that communication with them, you can do it in the most effective way. Also, it's helpful to go to the website app.leg.wa.gov/district finder if you're not sure of who your lawmaker is and what district you reside in. It's important to know who both your state senator is as well as your state representatives in the House. This is an example of some of the background information about a state senator, Jeff Holy. Knowing about their background, who they are as an individual, what role they play in their local community, can help you provide some, I guess you could say, pieces of information that would be useful and that might relate to their background a little bit better. Doing this background research is really helpful, especially before you meet with the individual in person, because it could serve as a way to open up conversation in a friendly way and also find ways to find areas of mutual interest. So now comes down to that piece of the pearls of persuasion. So when you are researching ahead of time, you want to ask yourself, who is your legislator? Where are they from? What committees do they sit on? Some information about their demographics, hobbies, or interests. What is their political party or philosophy? What is their WSNA voting record in the past? Other things you want to consider when discussing issues with your lawmaker are pieces of likability and personal connection. Is there a chance you might reside in the same city or went to the same school as that lawmaker? Do you have any similar hobbies or interests that you guys could discuss as part of an icebreaker when meeting first for a conversation? Offer to work with the legislator on other relevant issues in the district or related to your profession. This serves as a way of maintaining that connection to the lawmaker as you go about working with them on various issues. So I like to think of legislative advocacy in nursing as very similar to that of the nursing model. What we do every day with our patients and our communities involves assessment, diagnosis, planning, implementation, and evaluation. This same concept model can be applied to legislative advocacy, and I would have to say to solving most problems. By understanding advocacy through this lens, this really helps us build some confidence in our ability to advocate for our patients at the legislative level. It can oftentimes seem overwhelming or daunting at first, but when you look at it through this lens, I hope that it can help instill an increased level of confidence going into some of these meetings. So that first step is assessment. So really what you want to ask yourself is, what is the problem or issue that you would be best positioned to address? Is it on safe staffing or worker protection, or safe staffing standards? Is it on equity, justice, and transparency in healthcare? Is it about ARMP reimbursements or reimbursement parity, having the same pay for same service? Are you a nurse that's going to NP school to eventually become an ARMP, and will this potentially impact your practice? Gather information or examples about your experience with the issue. These stories are really impactful. You are their constituent, and it gives lawmakers a better pulse on what is really going on in the district. Stories can be provided without violating HIPAA in many ways. You don't need to be an expert on the nuances of bill language and passage, but know the top points of a bill and how it would impact your professional practice. The next step is planning. So now that you know what your issue is, how are you going to address the issue? Is it through a meeting with your lawmaker outside of session to help foster ideas for what bill language potentially could be? Is there already a bill in the state legislature or a bill that, say, your professional association is promoting that you could help advocate for in the next legislative session? Be sure, if you do meet with your lawmaker, that you plan on what the priorities are for the meeting. Is your priority to come up with bill language? Is your priority to address legislation that's already been passed and maybe potentially fix or tweak that language? Is your priority to help promote the priority of your professional association on legislation that is the top priority for them? But also know, when you do meet with your lawmaker, you might not be able to address every single issue. But by doing your research ahead of time, such as that background information on your lawmaker that we discussed earlier, you may want to choose specific pieces of legislation or ideas that are relevant to the lawmaker, based on that background that you identified, what committees they serve on, and their history on the issue. Just know, when it's an in-person meeting, be sure to check in on time, and be prepared for last-minute adjustments to your schedule. If it's a group meeting, which is what I would recommend for those of you that may be very nervous or uncertain about how these meetings may go, and it might be your first time meeting with your lawmaker in person, identify who might be best positioned to speak on a given issue. For example, if you have a group where really one of the focuses for that lawmaker is to talk about safe staffing issues, you may want the nurse that has experience with that directly, or that has that hospital or direct care experience, to advocate and tell their stories on that issue. Another important piece is to avoid acronyms or medical jargon. This is important because, as many of you know, acronyms run very, very wild in healthcare, and it is one of those things where oftentimes people who do not work directly in healthcare are aware of what those acronyms mean. So if at all possible, try to talk in the most simplistic way so that the person could understand, just like we do with our patients when we try to educate them at the bedside. It's also important to make sure that you're watching the clock. There's going to be a certain amount of time you want to budget for introductions and small talk, as well as a certain amount of time you want to really budget for getting into the meat of the topic and coming up with some solutions. If you have an individual meeting, you really may have more time to talk about your own story or personal experience with the issue, because it's just going to be you with that lawmaker one-on-one. For both types of meetings, you always want to go in with one thing that you know the answer to, and that is, what is your ask? What is your goal for this meeting? What are you going to ask the lawmaker to do by the time that you have, say, said your piece? By using this as a guide for your meeting, you really can get from point A to point B from the start and the finish of the meeting much more easily. Below are some pictures or images that you can see that if you meet online with your lawmaker, which is a great new innovative way to connect with your elected representatives, that there might be more stringent parameters around time frame. And for example, in this case, the legislative assistant is kind of giving a warning about how much time is remaining. And then we get to implementation. So implementation can be applied when you're, say, going forward with an advocacy strategy. So what is your plan in the legislature in order to get a bill through particular committees, in order to convince lawmakers in a legislative body to pass a piece of legislation, but implementing those plans that you had discussed or thought about previously also apply directly to the meeting. You can plan a lot, but once you get into the meeting, there's variables that sometimes can kind of come in that can affect the flow and the timing of the meeting. Oftentimes, it can be tempting to engage in length at small talk that's not really relevant to the issue priority. Some lawmakers actually may facilitate this, especially if they're undecided on a particular issue. It's important to remember that you should find a way to transition to the issue priority that you're there to talk about. Try to establish that personal connection, but avoid too much of that small talk. It's also important to identify why it is that the issue is important to you and what can be done about it, and how that solution really would impact you positively, as well as people in the district. It's also important to thank the lawmaker at the end of the meeting. Their time is valuable, just like our time as an advocate. And they do have other meetings that they have to get to. And the fact that they are present, or their legislative assistant is there and present to hear you out on your thoughts on a particular issue is important. One other thing that I would also make sure that I encourage is offering to be a resource for that lawmaker. Healthcare issues are very broad and vast, and oftentimes lawmakers that may not have a background in healthcare directly may want input from stakeholders. By offering to be a in-district local resource for that lawmaker, you can help build rapport, and that rapport can go a long way for developing new pieces of legislation that affect other issues as well in the future. It's always better to build a bridge than to burn one. And I think one of the most important pieces next would be nursing advocacy evaluation. So not all efforts and campaigns will come out positively or come up with the outcome that you had hoped for. But what's important is to recognize and reflect on what happened during that last meeting or that last session to understand what went well and what didn't go well. Was the lawmaker that, say, you met with, did they seem opposed or supportive of the issue that you brought up? It's also important to follow up with WSNA and provide feedback about the meeting. This will help WSNA plan throughout the session so that they know who to follow up with, which questions to answer, and also develop a better strategy for success for pieces of legislation. Just know that your skills and confidence will improve with each meeting. I still remember the first time that I met with my lawmaker, and I was terrified and extremely nervous. But by the end of the meeting, and I did meet with other nurses who had done this before, I felt passionate about the fact that I could actually make a difference and also positively impact the trajectory of a bill with just my story. So know that, remember, you are the expert in this situation, and that your story can have a much more impactful influence on how an issue moves forward through the legislature, because that's what lawmakers want to hear and want to know when it comes to the impact of legislation. So let's look at another video of Sally Sue after she has applied some of these concepts that we talked about at our throughout the course of this presentation. You can look back at some of those notes and see how some of them might apply in this video.
This is Sally Sue. She's been a nurse for 3 years. After getting her feet wet and learning the skills necessary to carry out nursing care with ease, she began to notice certain problems in her healthcare setting. Yada, 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 she got really worried. Let's fast forward and get to the point already. Finally, it dawned on Sally. She would go meet with her senator. She remembered a class she took in nursing school that gave her a template to use for political advocacy. She followed the 7 steps in order. She identified the problem. She did some background research and found out that the nursing association in her state had a bill in the committee regarding her very issue. She was able to print off a prepared sheet on the topic, complete with talking points. She joined her organization's political action committee. Next, she found her elected official. She found Senator Jones' contact information, his party affiliation, and his committee assignment. She found out that Senator Jones' daughter-in-law was also a nurse. Sally identified her goals. Sally spent several days really digging into the meat of the topic. She knew that her bill needed more co-sponsors. She understood the opposition's argument and developed a counter-argument. She also had a relevant personal story she was prepared to share with the senator. This was it, Sally's big day.
Hello, I'm Sally Sue from Central Hospital, here to meet with Senator Jones.
Hi, I'm Winnie.
Nice
I
to meet
am
you.
assistant for Senator Jones. I have healthcare issues for Senator Jones.
Oh, perfect.
Okay, I'm going to check with him, okay?
Okay.
Senator Jones, this is Sally Sue, the nurse from Central Hospital.
Hey,
Hi,
nice to meet you, Sally.
Thanks for having me.
Thank you for coming in. Feel free to take a seat.
Thank you.
Do you need any water or anything?
No, I'm good. I'm good.
Okay. Again, thanks for coming in today. Winnie told me a little bit about yourself and when you were making the appointment and that you're a nurse. And I just want to say thank you for what you do. Nurses do amazing work. And actually my own daughter-in-law is a nurse in the ICU. I think it's at Central Hospital.
That's fantastic.
Yeah, she does amazing work, 12-hour shifts. That's really difficult.
That is a tough job.
It is, but she's really passionate about it, and I really support her in that.
Well, I share your daughter-in-law's passion, and that's
Okay.
why I'm here today. But I do have some concerns about things I'm seeing at Central Hospital
Okay.
and other hospitals in the district.
Okay, we'll make sure we want to take some details here.
So here's what's going on.
Sally went on to articulate the problem she and her fellow nurses faced. She stuck to her talking points, showed the senator and his staffer a few statistics, and provided them with evidence that was in an easy-to-read format.
And Sally, you're bringing up some great points, and I hear those points. I do have to say I'm hearing something else from the Hospital Association of Hospital Administrators. Many of them feel like this is a local issue, and I have to ask, does there really need to be a law for this? I know that there's, you guys have unions, you have collective bargaining agreements. Can't this be handled there?
Well, that's a great question. But unfortunately, not all nurses in the state have unions representing them.
Okay.
It's district to district.
Okay.
And so, for example, truck drivers have mandated rest periods
That's true.
to ensure public safety.
Yeah.
We're asking the same thing in this bill for all nurses to have mandated rest periods for public safety, for patient safety. It's what they deserve.
That's a good point.
This led her naturally to the ask.
So, as you can see, there are some issues with patient safety, and we have some legitimate concerns. Right now, there happens to be a bill in the House that addresses these issues. It's House Bill 2399.
Yeah.
And what I would really appreciate is your support on that bill.
Okay.
And we would even like you to consider being a co-sponsor.
Okay. Well, what do you think, Winnie?
I think that's great. We are going to look at the bill and look at the data and get back to you. What do you think?
Yeah, as Winnie was saying, I read legislation before I actually say definite yes, but we obviously have a serious problem here, and I'm glad that you brought this up. The bill, based off of what it looks like and the information you provided, I think I would definitely support it, and I would see myself co-sponsoring it. Well, thank you very much for coming in. I appreciate it.
Thanks so much for having me.
She was a voice for her patients and an advocate for the nursing profession. As soon as she got home, she promptly executed Step 6, the follow-up. Sally went to the next meeting of her nursing association and reflected on her meeting. They discussed how they might re-strategize for the future. She engaged her peers and encouraged them to meet with their representatives as well. Thanks to Sally's compassionate, caring personality and commitment to better health for all, she was able to make a difference in many people's lives. Sally did her research, was well prepared, and was very personable. Ultimately, she not only won over the senator's vote, but also secured him as a co-sponsor of her bill. Wow, way to go, Sally.
So let's get to the key takeaways of this presentation. The first, and I think most important takeaway, is that you should remember that you are the expert on your own experiences. Lawmakers never know more than you do about what it is like to do your job. Obtain background information on a lawmaker before meeting with them. Know a little bit about who they are, what their background is, what committees they serve on, and what their priorities are. It's important that well before you meet with a lawmaker, you have goals for each meeting. Be a member of your professional association and watch for updates or action alerts. As many of you are aware, we live busy lifestyles, and we have full-time jobs, and that's why our professional association is there to do a lot of that groundwork and monitoring and provide you with updates when it's important for you to be active when, say, a bill is in a particular committee or in a particular legislative chamber and it needs to move forward. Use the resources from your professional association like WSNA to assist you. Oftentimes what WSNA will do as part of their action alerts is they'll have a prepared message that you can send to your individual lawmaker in your district. There are social media posts that you could consider reposting or sharing on your social media feeds. Remember, this is your professional association that's here to focus on serving you and your professional issues. So don't be afraid to utilize all the resources that WSNA gives you and provides you throughout the legislative session and throughout the year. This is an example of the WSNA action alerts. There is a website that you can go to sign up for some of these alerts and get weekly email updates from our government affairs team. Please feel free to read through some of those action alerts as they come in through your email. And responding to action alerts can actually be very quick and efficient with the ways that WSNA provides those resources. As always, if you have any questions or concerns, please don't hesitate to reach out to our government affairs team.
Well, hello everybody. Thank you so much for joining us thus far in the presentation about the introduction to legislative advocacy and the importance of nurses getting involved in legislative advocacy. We have three different panelists of nurses from across the state joining us here today to talk to you about their experiences in getting involved and staying involved in legislative advocacy and why they do it. And so we'll go ahead and introduce everyone today. First up, we have Kelsey Gellner. Hello, Kelsey. Good morning or good afternoon. Kelsey is a nurse at Seattle Children's and has been a nurse for over 5 years, starting in the adult med-surg in the ED and quickly transitioning to pediatric med-surg before landing in the PICU, the PICU. She has been seen a large variety of units and the barriers that impact each one. While she had been a part of WSNA her entire nursing career, she hadn't gotten involved in WSNA or legislative work until after her son was born. She saw from a patient and a parent perspective the toll our broken healthcare system has on our community and watched as her son received substandard care as she attempted to navigate the healthcare system. If I struggled, she thought to herself, I can't imagine what those not familiar with the healthcare system and setting must have endured as patients. When she returned to work after having her son, she returned to 80% of her unit having left, significantly worse working conditions, and the start of the 2022 viral season. She knew she had to get involved. That is when she jumped in head first to attending every meeting her local unit had And when a general inquiry was made to meet with state legislators, she was one of the first to raise her hand. Every time she volunteered, she was met with more opportunity. She quickly became a loud advocate for the safety and well-being of nurses and the patients they serve. Today, she is proud to be a night shift pediatric ICU nurse, a local union officer, and serve as the youngest member on the WSNA Board of Directors, so that she can collaborate with nurses across the state to be a powerful advocate for nurses. Next up, we have Dawn Marrick. Hi, Dawn.
Hello, good morning.
Dawn is from Southwest Hospital in Vancouver, Washington. Dawn graduated from Clark College with her associate's degree in nursing in 2009. Shortly thereafter, she began working on a medical surgical inpatient unit at the hospital in Vancouver Southwest Washington Medical Center. In 2019, she received her Bachelor of Science in Nursing from Washington State University. She has remained employed at her local hospital, which is now Peace Health Southwest Washington Medical Center, for the last 14 years. She currently works in the resource team as a charge and staff RN. She functions on many hospital-wide committees, including Staffing Committee, WSNA Conference Committee, Professional Nurse Advancement Program Committee, and Skin Champion Committee. She has functioned as grievance officer for her local WSNA unit since 2016 and is currently co-chair of her local WSNA unit. The following quote very succinctly spells out why advocacy is important to Dawn. I am no longer accepting the things I cannot change. I am changing the things I cannot accept. Angela Davis. Love that quote. Next up, we have Tristan Twohig from Spokane. Hello, Tristan.
Good morning. Thanks for having me.
Of course. Thank you so much for being here. Tristan is with Providence Holy Family in Spokane, Washington. Tristan is a board-certified emergency charge nurse at an emergency department and trauma center in Eastern Washington. Before entering the nursing field, he spent a decade in EMS and fire rescue in Alaska. In 2014, during the Ebola outbreak in West Africa, he attempted to volunteer with Doctors Without Borders in Ebola hospitals. However, they showed limited interest in medics and mandated a nursing degree as a minimum requirement for deployment to the hot zones. This led to his decision to enter the nursing field. Tristan became involved in legislative advocacy after witnessing the challenges within large hospital systems' bureaucratic processes. Working alongside many nurses in the emergency department, he noticed numerous complaints. Motivated to address these issues, he initiated discussions with decision makers, including meetings with the administration and directorship. Through these conversations, he effectively conveyed frontline concerns, leading to meaningful changes that improved working conditions on the floor, ultimately boosting employee satisfaction and enhancing patient safety. Solving problems brought Tristan surprising satisfaction, leading him to invest time in cultivating relationships with decision makers and expanding his engagement with WSNA. Through prioritizing advocacy for fellow nurses and the improvement of hospital systems, he's increased his involvement at both local and state levels. While partnering in task forces, committees, or collective actions may not always yield ideal solutions, he has confidence that those without a voice are adequately represented. Advocating for the disenfranchised disenfranchised stands as the pinnacle of his advocacy role. Thank you, everyone, again for being here. So I'm just going to go ahead and go into the first questions, and we will start with Dawn. She's first up on my screen here. So, okay. So the question to all of you, and again, Dawn, you'll go first. Advocacy can take many forms. As a nurse, you advocate at the bedside, in the community, and with hospital administration. You also advocate for your patients and for your profession through your elected officials. Two parts. One, how did you get involved in your advocacy work? And two, have you always been someone who's gotten involved in politics and in policy?
Okay. So I think what pushed me initially to become an advocate was kind of the corporatization of healthcare where I work. When I started at my community hospital, it was an independently run hospital, so it had been there many years. It was the only hospital in our area. I want to say in 2010 or 11, maybe, they were bought by a larger system. So it quickly became clear that the focus was shifting from patient safety and quality of care to focus on profit. And not a shift we wanted to see, obviously. So I initially started by joining committees, thinking affecting change in that way. So staffing committee, conference committee, unit-based council, to see if we could kind of affect change. I've been on those committees 9 years this year, I guess. And I will say, like, from a staffing committee point of view, I think in my 14 years, we have the highest nurse to patient ratios right now than we ever have. So I initially tried committee work to see if we could kind of fix that within the hospital, but it became clear pretty quickly that the hospital, unless forced to by law, wasn't really going to give us what we needed to take care of patients. So that's what kind of pushed me to start doing more legislative advocacy. So talking to representatives around here, I talked to them about Senate Bill 5236, getting signatures from nurses at work. I think I've talked to the news and done like short video clips to kind of help push along, mostly for staffing bills, but previously for the nurse safety bill, which I think we still need some changes there. So that's kind of the continuum of how I started being more of an advocate and kind of the avenues I tried and how I ended up helping in this capacity. As far as was I normally someone to stand up and kind of speak to the, absolutely not. No. So prior to seeing that corporatization and the shift of focus to profits, I was not someone to kind of stand up and speak on issues, but kind of quickly did. And then I started being active in the union as well. So I negotiated, thinking negotiations would be a good way to maybe get back to a focus on patient care and patient safety. And then, like I said, I became grievance officer and am now co-chair. So I tried all those different avenues and kind of landed on we need bigger change throughout the entire state to kind of, unfortunately, force hospitals like mine to do the right thing and shift the focus back to patient care and kind of treat nurses. I don't know about everyone else, but where I work, nurses are mostly treated like an operating cost that needs to be tightly managed rather than the biggest asset to our patients, because we really are the best predictor of good patient outcomes. So that's kind of the shift that I would like to see, and staffing is, I think, the biggest part of that.
That's great. Thank you, Dawn. And you have been a force down in the Southwest Washington area, the Vancouver area. So we really appreciate your involvement. I know when we go to Olympia, it's really great to have you and your counterparts down there from the Vancouver area talking and meeting with legislators and educating them on what's really happening at the bedside. So thank you for doing that work.
Yeah, and I think a lot of us will be there for lobby day, so you'll see some of us.
Great, great. Tristan, we'll have you go next. And I know we shared a little bit of this in your bio, so if you'd like to add anything to what we've already shared about why you got involved initially.
Sure. I think the anecdotal story would be sitting around in a break room with a bunch of nurses who are upset and complaining about the system is fine. And I think that just about any workplace anywhere has that. But there was a shift with hearing problems that could be fixed, but nobody seemed to be willing to take the initiative to address them. So my entrance into my involvement with advocacy work was taking these very small, mundane, unit-specific, shift-specific problems and approaching management and administration with a smile. And hey, how can we address these things? And that success early on was kind of the easy way in. From then, it turned into advocacy for not only my shift in unit, but joining the bargaining team, representing the entire hospital, bargaining on the sense of all nurses, of all units, of all specialties. probably was the launch pad for understanding that we're all in it together, although we have different agendas and problems. We can find solutions collectively. Have I always been someone to get involved with politics and policy? Yeah, I think so. I think that when you stand up for somebody who can't represent themselves or speaking on behalf of those who are disenfranchised and making sure that they're represented, I think that's an innate trait that most people who are actively involved and visibly involved with legislative and political advocacy have as a core fundamental value between any of us. So yes.
That's great to hear. And I think I definitely have that in common with you, Tristan. I think that is something that also motivates me to also work with nurses and people who are becoming nurses to tap into that and empower them to use their voice and take that concern and that care that they have. And then how do you channel that into something that can create bigger positive changes across whole systems, but improving the lives of nurses and patient quality as well. So I think that's great. We're really glad that you're on our side. Kelsey, next up, would you like to go ahead and take your stab at this question?
Yeah, I feel like I kind of jumped in all at once in trying to change my unit. You know, there's a saying about the best way to boil a frog is turning the water up 1 degree at a time. And if you slowly turn the temperature up, or if you slowly make the working conditions worse, it's hard to notice and it's hard to decide when to jump out. Me being on maternity leave while my unit was quickly going through a really hard turnover and quickly having worse working conditions, I was able to come back, and it was like you threw me in the pot of boiling water. And I knew immediately, like, this is not acceptable. We need to change this now. So I started looking into as many different ways as I could get involved. I started joining nursing-led committees. I started joining interdisciplinary committees. I just started responding to emails. We were in the middle of negotiations, and we would get emails like, if anyone would like to come to this meeting, feel free to join us. And I would just, it's on a day that I'm not working, I'm just going to show up. And every time I showed up, there was always a little bit more opportunity to do a little bit more. There's also plenty of opportunity to say no. Like, I never had to take on more than I wanted to, but it was really cool. The more I got involved, the more avenues that I saw, and the more change that I was able to help make. I think one of the coolest things was getting involved this past year, and getting to meet with state legislators and getting to know them and pass the safe staffing bill. And then later on this year, as we were struggling with our PBMU, our pediatric psych nurses, and the workplace violence that they have endured, some of those same legislators that I talked to about safe staffing, I was able to build on those connections and those relationships and be a familiar face as we're now talking about this next issue, and being heard in a way that hopefully we can make change not just for our hospital, but statewide. I definitely am not someone who is used to being involved in politics and speaking out on things like this. I never really was one to rock the boat, but there is not, we're all fighting for the same thing here. All of us want our patients to have safe care, and we all want to have good working conditions. So it feels like a no-brainer to advocate for that.
I love that. Thank you, Kelsey. And it's been really great to see for a number of years now, the entire unit at Seattle Children's working collectively to lift each other up and to help elevate the voices of your nurses and, of course, of your patients as well, and what's fair and just for them and how the system has failed them. And it's been really great seeing all the work that you guys really do together and work really well together as a team. And there's been some really great press coverage about these things that have been happening. So that's been fantastic. And, you know, you guys getting involved and you getting involved, Kelsey, is one of the best ways to do that. And I think other nurses, young nurses, seeing all of you do that and how that ends up helping raise the issues, I think is probably encouraging to other nurses as well, and perhaps and hopefully wants them encourages them to get involved as well. So we'll go ahead and go on to the next question here. Second question: what has been the most challenging part of your advocating experience, and what strategies have you found to be the most successful when advocating? Tristan, would you like to go first?
Sure. I think that the act of advocation is a purity of effort that we all have, right? We can actively advocate for things, policies, people, positions, but we can also advocate to an empty room. So being able to navigate the community of how hospital operations, how healthcare in general works, and being able to advocate effectively, I think it's a constant challenge. It's easier, I think, on a smaller level, on a local unit. When you first get started, you're talking to people who you know. Hospital relationships are personal. I think that holistically, relationships are paramount to getting things done on the advocacy level. And it's easy early on. And the higher you go in the levels of organization and healthcare systems, things get harder. There's a point where it's really hard to have a relationship with the governor. You're not going to be able to talk to the governor. So you have to be able to advocate in more almost decentralized, that's not the right word, more on a pathway with a coalition than having a single person having a single interaction. And that's just the different levels of being able to advocate on either state level or national level or region level advocacy issues. So some of the challenges would be trying to navigate that early on, because there really isn't a good playbook. You learn as you go. And eventually you're going to come across something you advocate for that you're not going to get. And you're going to suffer a loss with a lot of effort and a lot of what was assumed to be influence and being on the right side of history. You very well may be, but didn't get what you needed. And so, you know, the healthcare system is a beast. And in America, it is a tumultuous and turbulent area of both policy and operations. The economics of how healthcare works is underlining probably everything that we do, where we advocate for collectively advocate for nurse-patient ratios, safe staffing, being able to get the resources to the front lines, and that's what we're doing here as nurses. But there's a whole business side of it that is powerful and it is entrenched. And so being able to focus what we're trying to do and trying to be effective at what we're doing will not always lead to victories. But the process is it's a long game. And I have learned that the long game is probably the hardest part to accept. And I want victories now. I want my memo that I wrote, I want to have it resolved. And sometimes it's going to take, you know, a quarter or 6 months or a year or two. That also has yielded some of the most successful victories as well. So if you find yourself new in advocacy and come across a position where you get disgruntled, do not let go. This is just the beginning, and this is a lifelong fight. Lifelong fight. There, I'm done. Thank you.
That was a terrific answer, and I often run into that as well when working with nurses, especially people getting involved early on. They want to see progress happen faster. Why isn't the legislature moving faster? Well, big change happens in slower increments, unfortunately, but as you were saying, more substantial change impacting more people, hopefully in the long run, and good sound policy and getting nurses involved and helping us develop that good sound policy is one of the ways that we can make the most of that, what feels like glacier-like progress sometimes. But it certainly is very helpful, and we absolutely need nurses working directly with us in that to get your subject matter expertise. Dawn.
I think Tristan hit on most of the stuff that I would say as well. I would say over the years that I've functioned as an advocate, knowing who to speak to and what channels to use for what we're advocating for. At the beginning was very difficult. Now, after doing it for 9 years, it's a little bit easier to know maybe like what channel we should use to do that. We have committees, we have side meetings with administrators, we've signed petitions, we've informational picketed, we've filed grievance. So knowing which one to use for each to make the most change and kind of force them to come and talk about those issues with us, I would say is probably a hard part for a lot of people. I'm lucky to have like my co-chair and all of my other local unit officers that we can collectively kind of figure out the best way to get our message across. Strategies that have been most successful when advocating, the more nurses we can get together to deliver a message is usually the most powerful. So, the officers usually obviously stand together, but when we can engage the nurses at the hospital to kind of push that narrative, and we've had lots of times where we have open meetings where they're all invited. Anymore, the last few years has been on Teams, which easier for people to come. So when you have hundreds of nurses, when you're talking about issues, like we had a staffing grievance, we had hundreds of nurses show up to hear it and to be present for it. So really getting the nurses involved in it on the floor, because their voices are the most important. The other challenging thing about advocating sometimes is, Tristan hit on it, getting frustrated because it is very slow. And oftentimes you put so much effort into it and you don't get the outcome that you wanted. I know myself and my co-chair, Dee Dee Gray, during a lot of meetings, we have to preface and say, don't mistake my passion for anger. It comes from a good place. So that is something we find ourselves saying quite a bit, just to make sure they know, like, our intent is good. It is being passionate is what's behind that. So I would say that probably for a lot of nurses is something that can get frustrating, but they are big changes we want, and it's kind of incremental changes that we should expect to see. So I think that's probably all I can think of. And I think Tristan hit on most of those things already.
That's great. Fantastic. Thank you so much, Dawn. And Kelsey, what has been so far in your short journey so far, but also notable, been the most challenging part of your advocating experience, and what strategies have you found to be the most successful so far?
Yeah, I think there's been a barrier of entry, and then there's been a barrier of staying committed. I think the barrier of entry is just the relentless thought of, well, somebody should be doing something about that. What is the union doing about that? What is leadership doing about that? And it's very easy to point blame at the problem and what should be done. And it kind of was just a slight realization that I had, like, oh, wait, we actually are the union. That means me. That means if I want the union to do something, that means I should probably volunteer to do something. So that's really what started it all, was people would complain on night shift, especially when admin's not there and there's less resources. People would be complaining about, like, if we just changed this process, if we just changed this little thing. And I started keeping a note on my phone. And then I would go to leadership and I'd be like, hey, this is what your night shift nurses are saying. These are really easy fixes. Let's do this. And that was just like the little gateway. And once I got started and realized that I am capable of making change, that was like the first barrier of entry. Then once you get started, it is really easy to get overwhelmed with all that needs to be changed. I don't think anyone involved in the healthcare system thinks that the system is working flawlessly right now. I think we're all on the same page. There is a lot of work that needs to get done to make this better for patients, for staff, for everybody. There's so much work to do, and I think you actually spoke to it best, that the Seattle Children's officers are an incredibly powerful group. So the important part for me to remember was that that I'm not in it alone. It's not up to me to change everything. I don't have to fix the US healthcare system today. This is going to be a long fight, and it's going to take a lot of us, but many hands make light work. So if I'm struggling, it is so easy for me just to text one of the other officers, hey, can you pick this up for me? Or if I have time and I see another one of my officers struggling, I can quickly say, hey, let me take care of that. Like, I can take that for you. And we work so well as a team. And I think it's just knowing your resources and knowing who you can rely on and what everyone's strengths are has been monumental for us. Yeah.
Great. Thank you, Kelsey. And we will, Kelsey, I'll kick it back to you to kick us off on our last question, or responding to the last question in this panel. If you could give one piece of advice, or two if you need to nurses wanting to get involved or thinking about getting involved in legislative advocacy, what would that be?
I would say just start asking questions. Just if there's something that piques your interest, one info session, one email that Jess sends out, just reply. Just ask your questions, find out more information, and see if that's something that might spark interest for you. There's so many ways to get involved. You don't have to do everything, but if everybody does something, we can make so much cool change.
Thank you, Kelsey. Dawn.
I would say I think for a lot of the nurses where I work, it can be intimidating to know kind of where to start if you want to start being more active with legislative advocacy. I would say seeking out someone, there's always like-minded people that you can go to and kind of say, where should I start? And they can give you a good starting place or kind of let you know, like Kelsey said, there may be meetings they can kind of pop into and kind of see what they're asking people to do, see if it's an ask that they're comfortable doing and kind of starting there. But I think it can be intimidating to people to know kind of where to jump in. The other piece of it, once you've jumped in, that can be intimidating, I think, too, is thinking, does my independent voice matter to these decision makers? And I would say definitely yes. When you look at, for the staffing bill, when you listen to people that were testifying and you're seeing like CEOs or CNOs that have never done direct patient care, don't hold a medical degree, CNOs who are so far removed from patient care that what they're giving as far as their narrative doesn't fit what we see. I think remembering that we are the best person to speak to what our patients need because we're there with them every day. So it is an important voice to hear. But I've definitely been there when I've talked to representatives in this area when I started doing that, thinking, I know this individual, I know this would not generally be something they would support. Are they going to care about what I say? But we work it every day. I mean, throughout COVID, I was a COVID only nurse for years. So remembering that what you have to say in your experience is really important for them to hear, because it's our working conditions we're talking about. It's not CNOs, it's not CEOs, it's not the administrators. So I think those are the two that were like the biggest struggle for me that I think a lot of nurses might struggle with.
Absolutely. I think nurses put care in the word healthcare. And you guys you and Dee Dee and your colleague Duncan down there who's run for office. Yeah, and every one of you that gets involved down there have been a really great voice representing nurses in the Southwest area. You guys have been absolutely wonderful and great to watch and to work with. So thank you for all your leadership in that.
Yeah, I'm thankful for the team that we have. We do have a strong team down here, so we are very lucky.
Absolutely.
I love what Kelsey had said about everyone being part of the union. Nurses will come to us a lot as officers and kind of say, what is the union doing about this, that, or the other? And me and Dee Dee usually will turn it back around. Well, what are you doing about it? Because the union is me, but it's also you, right? So what are you doing about it? What actions are you taking, or who did you talk to, or what do you want to do? So getting our members to really realize it's them too. It's not just, the officers that are doing it, it's them. And they're more powerful when we get those groups of people together.
Empowering people is really exciting and can feel just so rewarding and contagious. I love that. You guys do a great job with that. Tristan, last but not least.
Yeah, I'm also a Dee Dee fan, and yay, Duncan. I mean, yeah, you guys are doing amazing work down there. For my advice for getting involved with legislative advocacy specifically, if you're new to it and you want to get involved, I think there's actually a couple different avenues. And the grassroots portion of me will start with engage with your local representative. And it sounds very cliche, but like show up to a town hall meeting. I mean, these are state legislators or congressmen or mayors, city councils, but introducing yourself as, hi, my name is Tristan. I'm a nurse. I have concerns, because we elect them. They should be listening to us. Should be, and usually do. Sometimes they don't. When you engage on the grassroots level, it helps make the case. Whatever case it is passionate for you over getting involved. That's the foundation for individual engagement. As far as the association goes, the WSNA has a wicked amazing governmental affairs and legislative team. And there's a Council of Legislative Advocacy, is that the name of it? They're incredible. And reaching out inside of the WSNA and asking specific people, specific questions about how best you can help. I mean, the more people we have, the better. So the grassroots side, the association side are two super strong avenues for engaging on legislative advocacy. And starting at the beginning it's not a hard thing to do, because it's not inventing the wheel yourself. There are people who've been doing this for generations, and becoming a part of that team and becoming more involved and getting more connected with the people who help make policy. That's like the best thing in the world. For those of us who do advocacy, and for those of us who like legislative action, I mean, the legislative session is like the best part of my year. I love it. Although I'm a nerd and people sometimes don't appreciate my enthusiasm of listening to Senate subcommittee hearings or, the appropriation bill discussions. That's really where, as I think Miranda wrote, in the room where it happens and the sausage is made. There's a song to it. I'm not going to sing it, but there's a Hamilton reference in here somewhere.
Oh, bummer.
No, just ask questions, just engage, just ask people who are available and who are accessible. And the WSNA does a really good job of making those people accessible and available. And if you're not part of WSNA, if you're looking for trying to get involved in perhaps a non-union hospital, the WSNA will, embrace you with open arms and get you connected with the people who you need to be connected with. The more people we have with our cause to be on the right side of history, for advocating for patient safety and for bettering the healthcare system, pushing back against the corporate economics that our healthcare systems become, is what we're all doing together in our own way, but we do it collectively. And the collective action is crucial for getting things done, for having a stance, and for having a position that we can all be unified for, or against. We're usually for things here.
Every once in a while against.
No, that's my spiel. Just ask questions, get engaged.
Love that. That's wonderful. Thank you. And for those nursing students who end up in a facility that maybe is not represented by WSNA in your bargaining unit, you can always join the association side. There are a number of wonderful benefits in being involved in WSNA, like opportunities to learn how to advocate for your profession and for your patients, joining us at Lobby Day in Olympia. And I would be remiss if I did not mention the PAC, the WSNA Political Action Committee. The stronger a political action committee is for a group of people, the more sway you will have in the policies that are being set, the more voice you have. So I also want to encourage folks to think about getting engaged and involved in their PAC and the Political Action Committee. So with that, unless anybody else has anything else they'd like to add, we will conclude this panel. Thank you, everyone, for joining us here this morning, and thank you to the audience.
A very brief recap of what we learned today. First, relationships matter. You will become the subject matter experts of your profession. There is no one better poised to do this than you. Next, find out who your elected officials are at the state and the federal level. Next, start to think about developing your own elevator speech. What would you tell your legislator now if riding in an elevator with them, as the name suggests, as a nursing student about what that experience has been like for you and why you're doing it? Then, once you graduate, apply that same concept of an elevator speech to your experience in being a nurse. You are an advocate and can be the voice for yourself, your fellow nurses, and the patients that you serve. What you experience, what you say, and what you think matters, and you can help shape good public policy for nursing. And last but not least, as nurses, you can become part of WSNA and continue your advocacy journey along with us. Together, we are stronger. We want to thank all of you future nurses for participating. We hope you found value in this presentation. If you would like someone from WSNA Government Affairs to visit with you or your nursing student colleagues or clubs more directly, or have questions about our work, please reach out to Jessica Hauffe, the Political Advocacy Manager, at jhauffe@wsna.org. We need more nurse advocates in our school board meetings, in our hospital board meetings, in our city and county councils, in our state legislature, and in Congress. Please also get involved in advocating for your patients and the nursing profession at your own hospital. Advocacy does not have to end at the bedside. When nurses are at the table, we get better health policy, stronger worker protections, and we keep the needs of our patients and our communities at the center of every conversation. We're inspired every time we hear nursing student stories about why they became a nurse. We hope to join you through WSNA after graduation to watch you advocate for your patients and your communities, and maybe even see some of you run for office one day. We want to encourage you to get involved with WSNA and our advocacy efforts, whether that's through the bargaining unit side or the professional association side of the organization. This concludes Introduction to Legislative Advocacy, brought to you by the Washington State Nurses Association.